Hi, this is Christine Sørensen. I'm Health Literacy Trailblazer, and I am looking forward to share a small reflection with you in this video. Some time ago, I came across an advice from Thich Nhat Hanh. He was known as the father of mindfulness, and he was a monk and a peace activist and an author. And I saw some of his resources on YouTube. He unfortunately passed away already in 2022. And one of his remarkable advices was about nurturing lettuce. And he said, when you plant lettuce, if it does not grow well, you don't blame the lettuce. You look for reasons it's not doing well. It may need fertilizer or more water or less sun, but you never blame the lettuce. And then he compares it to what we do with our friends and family, and say if we have problems with our friends and family, we often blame the other person. But if we know how to take care of them, they will grow well, just like the lettuce. And rather than blaming other people, he encourages us to understand. And he says, there's no blame, no reasoning, no argument, just understanding. And if you understand and you show that you understand, you can love and the situation will change. And he had experimented with this approach, trying to listen to people, try to understand them rather than, um, telling them what to do. And I reflected on this and said, well, when tendering to health literacy, we may actually apply the same approach. Because I think that if we want to grow health literacy, we best succeed if we nurture people's knowledge and motivation and competencies to find and understand and appraise and apply information to manage their health affairs rather than blaming them for not showing up or not knowing or not making any decisions and not being uh, compliant. So if we instead, show that we understand and we meet people where they are and try to nurture them according to their needs, then I guess there is a stronger chance that the situation will change and they will start, helping themselves to self care or um, being better to deal with their health and well being. We know that low health literacy, limited health literacy is a public health challenge that we should not neglect. We have all the evidence from, for example, the European Health Literacy Survey. And particularly, we need to make sure that people in vulnerable situations, that they have higher risk and take that into consideration. And this can be groups with low education or low income or being part of a minority or heavy users of health services. And we know people that have low levels of self-reported health are also more prone to limited health literacy. So one of the ways we could move forward, bearing in mind that we should not blame the lettuce, is really to adopt a health literacy approach called universal health literacy approach. And by this, we mean that we try to take into account that all will benefit from a health literacy friendly action. And all will benefit if we start to nurture people and look for those with specific needs and tailor the means based on a deep understanding of the issues that are at stake. And only in that way we can improve health literacy of the individuals and the communities and the societies. We also know that it requires constant gardening, just like the fields of lettuce. But blaming people for the lack of knowledge and motivation and skills will not be beneficial for them to flourish. Instead, if we try to to improve them by enabling people to participate and be engaged in their health, then we can do it by asking what matters to them. And in that way, we can pave the way for a deeper understanding of their hopes and dreams and capacity to execute. Instead of just asking what matters with them, we can ask what matters to them. I truly believe that health literacy empowers people for better health and well being, and health literacy helps improve the quality of life. And I recall this old ancient proverb: the seeds of today are the flowers of tomorrow. So when we try to sow the seeds of health literacy, hopefully we can benefit from the flowers of tomorrow and see people flourish. And by doing that, we have to recall also not to blame the lettuce, not to blame the flowers, but helping to create and develop conducive environments. So, in order for that to happen, I hope you will be the change you want to see in the field of health literacy, that you start nurturing, that you start to do gardening in a way where we start with understanding and in that way help people to grow. Thank you for listening, and I look forward to see you in another video. Take care.